Hello students, welcome to Chapter 21, Toxicology. After students complete this chapter and the related coursework, they will be familiar with the classes and compounds involved in substance abuse and poisoning, the routes by which poisons enter the body, and the signs and symptoms, assessments, and treatment for various poisoning emergencies. Introduction. Every day we come into contact with things that are potentially poisonous. Almost any substance may be a poison in circumstances. Different doses can turn even a remedy into a poison. For example, aspirin. Acute poisoning affects 2 million people each year. Chronic poisoning is more common. Deaths caused by poisoning are fairly rare. Rates of death as the result of poisoning in children have decreased steadily since the 1960s due to child-resistant caps. Death caused by chronic poisoning in adults have been rising as a result of drug abuse. Identifying the patient and the poison. Toxicology is the study of toxic or poisonous substances. A poison is any substance whose chemical action can damage body structures or impair body function. A toxin is a poisonous substance produced by bacteria, animals, or plants that acts by changing the normal metabolism of cells or destroying them. Toxins can have acute or chronic effects. Substance abuse is the misuse of any substance to produce a desired effect. A common complication of substance abuse is overdose, when a patient takes a toxic dose of a substance. Your primary responsibility to the patient who has been poisoned is to recognize that a poisoning has occurred. For your own safety, you must pay attention to your surroundings, or you could also become exposed to the same substance. The where, what, and how of the toxic exposure is important. Very small amounts of some poisons can cause considerable damage or death. If you suspect the ingestion or exposure of a toxic substance has occurred, notify medical control and begin emergency treatment at once. The signs and symptoms of poisoning vary according to the specific agent. The presence of injuries at the patient's mouth strongly suggests the ingestion or swallowing of a poison. The table on this slide shows the signs and symptoms of specific types of overdoses. If possible, while obtaining the sample history, ask the patient, what substance did you take? When did you take it or become exposed to it? How much did you ingest? Did you have anything to eat or drink before or after you took it? Has anyone given you an antidote or any substance orally since you ingested it? How much do you weigh? Try to determine the nature of the poison. Look around the immediate area for an overturned bottle, a needle or syringe, scattered pills, chemicals, remains of food or drink items, or even an overturned or damaged plant. Place any suspicious material in a plastic bag and take it with you. Containers at the scene can provide critical information such as name and concentration of the drug, ingredients, number of pills originally in the bottle, name of the manufacturer, and prescribed dose. If the patient vomits, examine the contents for pill fragments. Wear proper personal protective equipment. Note and document anything unusual that you see. How poisons enter the body. Emergency care for a patient who has been poisoned may include actions that range from reassuring an anxious parent to performing CPR. Most often, you will not be administering a specific antidote because most poisons do not have one. The medication antidote most commonly available to pre-hospital providers is naloxone, which is used to reverse the effects of an opioid overdose. Definitive treatment can only be provided at the ED, so transport promptly. The most important treatment you can perform for poisoning is diluting and/or physically removing the poisonous agent. How you provide treatment depends on how the poison got into the patient's body in the first place. The four routes to consider are inhalation, absorption, surface contact, ingestion, and injection. The figure on this slide shows the four routes poison can enter the body: inhalation, absorption, ingestion, and injection. All four routes of poisoning can lead to serious and possibly life-threatening conditions. Take care to treat patients appropriately. Keep yourself safe from harm. If you are uncertain how to treat a patient who has been poisoned or exposed to a specific substance, find the container if possible and contact medical control and/or the Poison Control Center before you proceed. Inhaled poisons. Move the patient into fresh air immediately. The patient may require supplemental oxygen. If you suspect the presence of a toxic gas, call for specialized resources such as the hazmat team. A self-contained breathing apparatus is necessary to protect yourself from poisonous fumes. Some patients may need decontamination by the hazmat team after removal from the toxic environment. The patient's clothes should be removed in this process because it may contain trapped gases that can be released, exposing you to the substance. The patient may have the following signs and symptoms: burning eyes, sore throat, cough, chest pain, hoarseness, wheezing, respiratory distress, dizziness, confusion, headache, or stridor in severe cases. All patients who have inhaled poison require immediate transport to an emergency department. Be prepared to use supplemental oxygen via a non-rebreather mask and/or ventilatory support with a BVM if necessary. Pulse oximetry readings may not be accurate if with inhaled poisons. Make sure a suctioning unit is available in case the patient vomits. Some patients use inhaled poisons to commit suicide in a vehicle. Leaving a car engine running in an enclosed garage can cause the exhaust fumes, which contain high levels of carbon monoxide, to cause the patient to lose consciousness and eventually stop breathing. A recent variation involves using chemicals or detergent in a tightly sealed vehicle as a type of gas chamber. When you open the door, you may be overcome as well. Contact hazmat responders and have them remove the victim. Absorbed and surface contact poisons. These poisons can affect the patient in many ways: skin, mucosal membranes, or eye damage, chemical burns, rashes or lesions, systematic effects. It is important to distinguish between contact burns and contact absorption. Signs and symptoms of absorbed poisoning include a history of exposure, liquid or powder on the patient's skin, burns, itching, irritation, redness of the skin, typical odors of the substance. Emergency treatment for a typical contact poisoning includes: avoid contaminating yourself and others. While protecting yourself, remove the substance from the patient as rapidly as possible. Remove all contaminated clothing. Flush and wash the skin. If dry powder has been spilled, brush off the powder, then flood the area with water for 15 to 20 minutes. Then wash the skin with soap and water. If liquid has been spilled onto the skin, flood for 15 to 20 minutes. A chemical agent is introduced to the eyes. Irrigate them quickly and thoroughly. Many chemical burns occur in an industrial setting. Safety showers and specific protocols for handling surface burns may be available. A hazmat team should be available to assist you. Ensure you, your team members, and the exposed patient are thoroughly decontaminated. After decontamination, promptly transport to the ED for definitive care. Obtain material safety data sheets and transport with the patient. If not immediately available, have the company fax them to the hospital. Ingested poisons. About 80% of poisoning is by mouth. Liquids, household cleaners, contaminated food, plants, or drugs. Ingested poisoning is usually accidental in children and deliberate in adults. Signs and symptoms vary greatly with the type of poison, age of patient, time that has passed since the ingestion. Signs and symptoms include burns around the mouth, gastrointestinal pain, vomiting, cardiac dysrhythmias, and seizures. Treat signs and symptoms and notify the poison center and medical control of the patient's condition. If the patient has altered mental status, protect the patient from aspirating on vomit. Consider whether there is unabsorbed poison remaining in the gastrointestinal tract and whether you can safely and effectively prevent its absorption. Some EMS systems allow EMTs to administer activated charcoal. You should always immediately assess the airway, breathing, and circulation, the ABCs of every patient who has been poisoned. Injected poisons. Exposure by injection includes intravenous drug abuse and envenomation by insects, arachnids, and reptiles. Injected poisons are usually absorbed quickly into the body or cause intense local tissue destruction. They cannot be diluted or removed from the body in the field. The patient's condition can be life-threatening. You must act quickly. Signs and symptoms include weakness, dizziness, fever, chills, unresponsiveness, and excitability. Monitor the airway, provide high-flow oxygen, and be alert for nausea and vomiting. Remove rings, watches, and bracelets from areas around the injection site if swelling occurs. Patient assessment, scene size-up. A well-trained dispatcher can obtain important information pertaining to a poisoning call, including proper protection needed, information pertaining to the MOI or NOI, number of patients involved, additional resources needed, whether trauma is involved. Take standard precautions and look for clues that might indicate the substance involved. Ask yourself the following questions. Is there an odor in the room? If so, is the scene safe? Are there medication bottles lying around the patient and the scene? If so, is there medication missing that might indicate an overdose? Are there alcoholic beverage containers present? Are there syringes or other drug paraphernalia on the scene? Is there a suspicious odor and/or drug paraphernalia present that may indicate the presence of a drug laboratory? Keep a constant eye on the surroundings and keep an open mind when questioning the patient or bystanders to avoid mistaken conclusions. Primary assessment. Determine the severity of the patient's condition. Obtain a general impression of the patient. Assess his or her level of consciousness. Determine any life threats. Do not assume a conscious, alert, and oriented patient is in stable condition. Airway and breathing. Quickly ensure that the patient has an open airway and adequate ventilation. If the patient has any difficulty breathing, begin oxygen therapy. If the patient may have an inhalation injury, place the patient on high-flow oxygen regardless of the pulse oximetry reading. Consider inserting an airway adjunct in unresponsive patients. Have suction available. These patients are susceptible to vomiting. You may have to assist ventilations with a BVM because some substances act as depressants. Circulation. Assess the pulse and skin condition. You will find variations depending on the substance involved. Transport decision. Consider prompt transport for patients with obvious alterations in the ABCs or for patients who have a poor general impression. Everyone who is exposed to a hazardous material must be thoroughly decontaminated by the hazmat team before leaving the scene. History taking. Investigate the chief complaint. Obtain the patient's medical history. This can be performed en route. If the patient is responsible, begin with an evaluation of the exposure and the sample history. If the patient is unresponsive, attempt to obtain the history from another source, such as coworkers, bystanders, friends, family members, medical identification jewelry, wallet cards. Sample history. A sample history guides you in what to focus on as you continue to assess the patient's complaints. The physical examination and vital signs tell you what is happening to the patient's body. In addition to the sample history, ask the following questions. What is the substance involved? When did the patient ingest or become exposed to the substance? How much did the patient ingest, or what was the level of exposure? Continuing the questions that should be asked. Over what period did the patient take or was exposed to the substance? Has the patient or a bystander performed any intervention? Has the intervention helped? How much does the patient weigh? Secondary assessment. You may not have time to conduct a secondary assessment. Physical examinations. Focus on the area of the body involved with the poisoning or the route of exposure. Once the ABCs have been addressed and managed in the primary assessment, conducting a thorough physical examination will provide additional information on the exposure. A general review of all the body systems may help to identify systematic problems. A complete set of baseline vital signs is important. Many poisons produce no outward indication of the seriousness of the exposure. Alterations in the level of consciousness, pulse, respirations, blood pressure, and skin are more sensitive indicators that something serious is wrong. Reassessment. Continually reassess the adequacy of the patient's ABCs. Repeat vital signs. Compare them with the baseline set. Evaluate the effectiveness of your interventions you have provided. Every 15 minutes for a stable patient, and every 5 minutes or constantly for a patient who has consumed a harmful or lethal dose. Treatment. Supporting the ABCs is your most important task. Contact medical control or a poison center to discuss treatment options. Dilute airborne exposures with oxygen. Remove contact exposures with copious amounts of water unless contraindicated. Consider activated charcoal for ingested poisons. Communication and documentation. Report as much information as you have about the poison or chemical to the hospital. If the poisoning or exposure occurred in a work setting, bring or have the company fax the material data sheet to the hospital. Ensure scene safely. Follow standard precautions. Perform external decontamination. Remove tablets or fragments from the patient's mouth and wash or brush the poison from the patient's skin. Treatment focuses on support. Assess and maintain the patient's ABCs. Provide oxygen and perform assisted ventilations if necessary. Treat for shock if necessary and transport the patient promptly to the nearest appropriate hospital. Some EMS systems allow EMTs to give activated charcoal by mouth. Activated charcoal binds to specific toxins and prevents their absorption by the body. The toxins are then carried out of the body in the stool. Activated charcoal is not indicated for patients who have ingested alkali poisons, cyanide, ethanol, iron, lithium, methanol, mineral acid, or organic solvents, and who have a depressed level of consciousness and cannot protect their airway. If local protocol permits, you will likely carry plastic bottles of pre-mixed suspension, each containing up to 50 grams of activated charcoal. Some common trade names are Instachar, Antidose, and Liquichar. The usual dose for an adult or child is 1 gram of activated charcoal per kilogram of body weight, 30 to 100 grams for adults, and 15 to 30 grams for children. Before you give a patient charcoal, obtain approval from medical control. Shake the bottle vigorously to mix the suspension. You may need to convince the patient to drink it, but never force it. Shake the container frequently to keep the medication mixed. Once the patient has finished, discard the container. Record the time you administered activated charcoal. If the patient refuses activated charcoal, document the refusal and your attempts to counsel the patient and transport the patient for further evaluation. Side effects of ingesting activated charcoal are constipation and black stools. If the patient has ingested a poison that causes nausea, he or she may vomit after taking activated charcoal, and the dose will have to be repeated. Specific poisons. Over time, a person who routinely misuses a substance may need increasing amounts of it to achieve the same result. This is called developing a tolerance to the substance. A person with an addiction has an overwhelming desire or need to continue using the substance at whatever cost, with a tendency to increase the dose. Almost any substance can be abused. The importance of safety awareness and standard precautions in caring for victims of drug abuse cannot be overemphasized. Known drug abusers have fairly high incidence of serious and undiagnosed infections, including HIV and hepatitis. These patients may bite, spit, hit, or otherwise injure you. Always wear appropriate protective equipment. Accept the unexpected, and remember, the drug user, not the drug, can pose the greatest threat. Alcohol. Many calls for service have a connection to alcohol use. 1 in 10 deaths among working-age adults in the United States can be attributed to excessive alcohol use.
Alcohol can damage the liver, whether through chronic overuse or the occasional heavy use, binge drinking. Binge use can be more damaging than chronic use, depending on the frequency of the binging and the surrounding circumstances.
Alcohol is a powerful CNS depressant. It is a sedative, depresses activity and excitement, and a hypnotic, induces sleep. In general, alcohol dulls the sense of awareness, slows reflexes, and reduces reaction time. It may also cause aggressive and inappropriate behavior and lack of coordination. A person who appears intoxicated may have other medical problems as well. Look for signs of head trauma, mental illness, toxic reactions, or uncontrolled diabetes. Severe acute alcohol ingestion may cause hypoglycemia. Assume that all intoxicated patients are experiencing a drug overdose and require a thorough examination by a physician. Alcohol increases the effects of many other drugs and is commonly taken with other substances. If a patient exhibits signs of a serious CNS depression, provide respiratory support. Depression of the respiratory system can also cause anemia or vomiting. The vomiting may be forceful or even bloody, hematominous, because large amounts of alcohol irritate the stomach. Internal bleeding should also be considered if the patient appears to be in shock. Patients in alcohol withdrawal may experience frightening hallucinations or delirium tremens, DTs. The syndrome is characterized by agitation and restlessness, fever, sweating, tremors, confusion and/or disorientation, delusions and/or hallucinations, seizures. These conditions may develop after a person stops drinking or when alcohol consumption levels are decreased suddenly. Provide prompt transport. Reassure the patient and provide necessary care and emotional support. Opioids. A narcotic is a drug that produces sleep or altered mental consciousness. An opioid is a type of narcotic medication used to relieve pain. An opiate is a substance of the opioid family and refers to natural, non-synthetic opioids. Opioids are named for the opium in poppy seeds, from which codeine and morphine are derived. Synthetic opioids include mepridine, hydromorphone, oxycodone, hydrocodone, and methadone. Prescription opioid drugs are among the most commonly abused drugs in the United States. Some people become physically dependent on opioids after taking an appropriate medical prescription. The death rate from heroin overdoses tripled between 2010 and 2013 to 40. These agents are CNS depressants and can cause severe respiratory depression and then cardiac arrest if not treated promptly. Tolerance develops quickly, so some users may require massive doses to experience the same high. These drugs often cause nausea and vomiting and may lead to the development of hypotension. Although seizures are uncommon, they may occur. Patients typically appear sedated or unconscious and cyanotic with pinpoint pupils. Pinpoint pupils are the most commonly accepted sign of opiate abuse. Naloxone or Narcan is an antidote that reverses the effects of opiate or opioid overdose. It can be given by the intravenously, intramuscularly, or intranasally. In many EMS systems, EMTs administer naloxone by the intranasal route, atomized through the nares into the nasal mucosa. Should only be used when a patient has agonal respirations or is apneic. Place an oropharyngeal airway and ventilate the patient using a BVM prior to administering naloxone. Adequate ventilations decrease the risk of permanent brain damage related to hypoxia. As the level of consciousness rises, the patient will react to the presence of an oropharyngeal airway, and you will have to remove it to prevent aspiration. In some areas, lay people are permitted to administer naloxone. Find out from bystanders if the patient was given naloxone. Sedative and hypnotic drugs. Barbiturates and benzodiazepines are easily to obtain and relatively cheap. These drugs are CNS depressants and alter the level of consciousness with effects similar to those of alcohol. The patient may appear drowsy, peaceful, or intoxicated. In general, these agents are taken by mouth. Users often take alcohol or an opioid at the same time to boost their effects. Occasionally, the capsules are suspended or dissolved in water and ejected. IV sedative hypnotic drugs quickly induce tolerance, so the person requires increasingly larger doses. These drugs may be given to people as a knockout drink or a Mickey Finn to incapacitate them without their knowledge. Generally, your treatment is to ensure airway is patent, assist ventilations, and provide prompt transport. Abused inhalants. These agents are inhaled instead of ingested or injected. Some of the most common agents include acetone, toluene, xylene, and hexane, found in glues, cleaning products, paint thinners, and lacquers. Gasoline and various halogenid hydrocarbons such as furan, used as propellants in aerosol cans, are also abused as inhalants. These are commonly abused by teenagers. The effective dose and the lethal dose are very close, making these extremely dangerous drugs. Take special care in dealing with a patient who may have used inhalants. Halogenid hydrocarbon solvents can make the heart hypersensitive to the patient's own adrenaline. Even the action of walking may cause a fatal ventricular dysrhythmia. Try to keep such patients from struggling with you or exerting themselves. Use a stretcher to move the patient, give oxygen, and provide transport to the hospital. Hydrogen sulfide. Hydrogen sulfide is highly toxic, colorless, and flammable gas with a distinctive rotten egg odor. Poisonings usually occur by inhalation. Hydrogen sulfide affects all organs, but it has the most impact on the lungs and CNS. Used to commit suicide, referred to as a chemical or detergent suicide. If you approach an enclosed vehicle with an unconscious patient inside, be alert for warning signs, as well as containers, buckets, or pots. If you suspect a presence of a toxic gas, wait for a hazmat team to tell you the scene is safe.
Signs and symptoms include nausea and vomiting, confusion, dyspnea and loss of consciousness, seizures, shock, coma, and cardiopulmonary arrest. Once the patient has been decontaminated, management is largely supportive. Monitor and assist the patient's respiratory and cardiovascular functions. Provide rapid transport.
Synthiomimics. Synthiomimics are CNS stimulants that mimic the effects of the sympathetic flight or fight nervous system. These stimulants frequently cause hypertension, tachycardia, and dilated pupils. A stimulant is an agent that produces an excited state. Examples include amphetamines, methamphetamines, phenmine, hydrochloride, and amphetamine sulfate. Designer drugs such as MDMA, ecstasy, or Molly are also frequently abused in certain areas of the United States. Commonly taken by mouth, they are also injected by drug users. Cocaine may be taken in a number of different ways. It can be absorbed through the mucosal membranes and even across the skin. Immediate effects include excitement and euphoria and last less than an hour. Smoked crack produces the most rapid means of absorption and therefore the most potent effect. Acute overdose is a genuine emergency. Patients have high risk of seizures, cardiac dysrhythmias, and stroke. Patients may be experiencing hallucinations or paranoia, placing you at risk. Law enforcement officers should restrain the patient if necessary. Do not leave the patient unattended during transport. Patients need prompt transport to the ED. Give supplemental oxygen and be ready to provide suctioning. Synthetic cathones, or bath salts, an emerging class of drugs similar to MDMA, sold as bath salts to escape the legal restrictions imposed on illicit drugs. Brand names include Ivory Wave and Cloud9. Cathones produce euphoria, increased mental clarity, and sexual arousal. Most users of this drug snort or insufflate the powder nasally. Effects reportedly last as long as 48 hours. Adverse effects include teeth grinding, appetite loss, muscle twitching, lip smacking, confusion, gastrointestinal conditions, paranoia, headache, elevated heart rate, and hallucinations. Keep the patient calm and transport. Consider ALS assistance. Some of these patients may require chemical restraint to facilitate safe transport.
Marijuana. Marijuana is abused throughout the world. Nearly half of Americans have tried marijuana. Tetrahydrocannabinol, or THC, is the chemical in marijuana plant that produces its high. Inhaling marijuana smoke produces euphoria, relaxation, and drowsiness. It impairs short-term memory and the capacity to do complex thinking and work. The euphoria can progress to depression and confusion. With very high doses, patients may experience hallucinations or become very anxious or paranoid. Reassure the patient and transport with the minimal amount of excitement. Marijuana is often used as a vehicle to get other drugs into the body. Several states have legalized the recreational use of marijuana, and others allow for the medical use of marijuana and products that contain THC. Edibles or baked goods, candies, and other food additives that have been infused with marijuana ingestion can lead to cannabinoid hemorrhasis syndrome, characterized by chronic marijuana use and extreme nausea and vomiting that is relieved only by a hot shower or bath. Synthetic marijuana or spice refers to a variety of herbal incenses or smoking blends that resemble THC and produce a similar high. Powerful and unpredictable side effects may result, ranging from simple euphoria to complete loss of consciousness. Hallucinogens alter a person's sensory perceptions. The classic hallucinogen is lysergic acid.
dithylamide, LSD. Abuse of PCP is relatively uncommon among young adults. PCP is a dissociated anesthetic that is easily synthesized and highly potent. These agents cause visual hallucinations, intensifying vision and hearing, generally separate the user from reality. Patients experiencing a bad trip have hypertension, tachycardia, anxiety, and paranoia. Your care is the same as that for a patient who has taken a symptomatic. Use a calm professional manner, provide emotional support. Do not use restraints unless you or the patient is in danger of injury. Watch the patient carefully throughout the transport and do not leave unattended. Request ALS assistance when appropriate. Entheogenic agents. These medications that have properties that block the parasympathetic nerve. The classic picture of a person who has taken too much of an entheogenic medication is hot as a hare, blind as a bat, dry as a bone, red as a beet, and mad as a hatter. Common drugs include atropine, Benadryl, Jimson weed, and amitriptyline. With the exception of Jimson weed, these medications usually are not abused drugs. It is often difficult to distinguish between an anthellergic overdose and a symptomatic overdose. Both groups of patients may be agitated and have tachycardia and dilated pupils. Some tricyclic antidepressants have specific anticholinergic effects. Death from these agents can be rapid. The patient can go from appearing normal to seizure and death within 30 minutes. The seizures and dysrhythmias are best treated in the hospital. Transport immediately. Consider calling for ALS backup en route. Cholinergic agents. These agents overstimulate normal body functions that are controlled by the parasympathetic nerves. Includes nerve gases designed for chemical welfare and organ phosphate insecticides. Poisoning results in excessive salivation or drooling, mucous membrane oversecretion, runny nose, excessive urination, tearing of the eyes, uncontrolled diarrhea, and abnormal heart rate. The signs and symptoms of a chlorogenic drug poisoning are easy to remember with the mnemonic dumbbells. D is for diarrhea, U is for urination, M is for molsis, constriction of the pupils, B is for bradycardia, bronchial spasm, bronchial chorea, discharge of mucus from the lungs. E is for emesis, vomiting. L is for lacrimation, tearing. S is for seizures, salivation, and sweating. Alternatively, you could use the mnemonic sludge gem, salivation, sweating, lacrimation, urination, defecation, drooling, diarrhea, gastric upset and cramps, emesis, muscle twitching, and molsis. The most important consideration is to avoid exposure yourself. Decontamination may take priority over immediate transport. In many jurisdictions, the hazmat team will provide decontamination and contain the exposure chemical. Your priorities after decontamination are to address the secretions in the mouth and trachea, provide airway support. Antidote kits may be available. Most common is the DuDote auto-injector. The kit contains a single auto-injector containing atropine and paroxetine. If a known exposure to nerve agents or organ phosphates with manifestation of signs and symptoms have occurred, use the antidote kit on yourself.
Miscellaneous drugs. Accidental or intentional overdoses with cardiac medications has become common. Children may ingest them thinking they are candy. Older patients may forget and take a second dose of their medication.
Signs and symptoms depend on medication ingested. These drugs may cause bleeding, cardiac dysrhythmias, unconsciousness, and even cardiac arrest. Contact the poison center as soon as possible. You may be ordered to administer active charcoal. Aspirin poisoning remains a potentially lethal condition. Ingesting too many may result in nausea, vomiting, hyperventilation, and ringing in the ears. Patients with this problem frequently have anxiety, confusion, tachypnea, hyperthermia, danger of having seizures. Overdosing with acetylcholine and medications that contain acetylcholine is also common. Among the top 25 substances with the largest number of fatalities due to poisoning, overdose, unintentional or intentional, must be treated promptly and aggressively. Accidental acetylcholine overdose is as serious as intentional overdose. Patient is unaware of continuous exposure to the toxin, and massive liver failure may not be apparent for a full week. Gathering information at the scene is very important. Some alcohols, including methyl alcohol, ethyl glycol, and even more toxic ethyl alcohol, both will cause severe tachypnea, blindness, renal failure, and eventually death. Immediate transport to the emergency department is essential. Food poisoning is almost always caused by eating food contaminated by bacteria. There are two main types of food poisoning. The organism itself may cause disease. The organism may produce toxins that cause disease. One organism that produces direct effects of food poisoning is the Salmonella bacterium. Salmonellosis is characterized by severe gastrointestinal symptoms within 72 hours of ingestion, including nausea, vomiting, abdominal pain, and diarrhea. Proper cooking kills bacteria, and proper cleanliness in the kitchen prevents the contamination of uncooked foods. The more common cause of food poisoning is the ingestion of powerful toxins produced by bacteria, often in leftovers. The bacterium Staphylococcus is quick to grow and produce toxins in food. Food left unrefrigerated are a common vehicle. Results in sudden GI symptoms, including nausea, vomiting, and diarrhea. Symptoms usually start within 2 to 3 hours after ingestion, or as long as 8 to 12 hours after ingestion. The most severe form of toxin ingestion is botulism. Botulism can result from eating improperly canned food. The spores of the Clostridium bacteria grow and produce a toxin. The symptoms are neurologic: blurring of vision, weakness, difficulty in speaking and breathing. Often fatal, symptoms may develop within the first 24 hours after ingestion or as long as 4 days later. In general, do not try to determine the specific cause of acute gastrointestinal problems. Gather as much history as possible from the patient. Transport him or her promptly to the hospital. When 2 or more persons in one group have the same illness, you should take along some of the suspected food. Plant poisoning. There are tens of thousands of cases of plant poisoning annually. Many household plants are poisonous if ingested. Some cause local skin irritation. Some can affect the circulatory system, gastrointestinal tract, or the CNS. It is impossible to memorize every plant and poison, let alone their effects. You can and should do the following: assess the patient's airway and vital signs, notify the regional poison center for assistance in identifying the plant, take the plant to the emergency department, provide prompt transport. The figure on this slide shows common poisonous plants: Dipherbena, mistletoe, castor bean, nightshade, and foxglove. The figure on this slide shows common poisonous plants: Jimson weed, death cams,
poison ivy, poison oak, pokeweed, and rosy pea. Irritation of the skin and or mucosal membranes is a problem with common houseplant called Dipherbena. When chewed, a single leaf may irritate the lining of the upper airway enough to cause difficulty swallowing, breathing, and speaking. Emergency medical treatment includes maintaining an open airway, giving oxygen, transporting the patient promptly to the hospital for respiratory support. Okay, class, let's go over some review questions. Review question number 1. Which of the following questions is of least pertinence for the EMT to ask a patient who intentionally overdosed on a medication? A. How much do you weigh? B. How much did you ingest? C. What substance did you take? D. Why did you take the medication? The correct answer is D. Determining what the patient ingested, how much they ingested, and the patient's weight are all pertinent and have a direct impact on the care that is provided during the acute phase. Why the patient ingested the medication does not have a direct impact on the acute care. Therefore, it is the least pertinent question to ask. How much do you weigh? This is a very pertinent question and can impact treatment because treatment can be determined by how much they weigh. How much did you ingest? Again, this is a very pertinent question and can impact treatment. What substance did you take? This is a very, very pertinent question and can impact treatment. D. Why did you take the medication is the correct answer. It's not needed to know to treat them. Review question 2. A 30-year-old male who ingested an unknown substance begins to vomit. You should A. Collect the vomit and bring it to the hospital. B. Apply a bag valve mask. C. Analyze the vomitus and try to identify the poison. D. Suction his oral pharynx for no longer than 30 seconds. The correct answer is A. If the patient vomits, examine the contents for pill fragments. Ensure that you are wearing proper personal protective equipment for this activity. Note and document anything unusual that you see. You should try to collect the vomitus in a separate plastic bag so that it can be analyzed at the hospital. The correct answer is A. You should collect the vomitus and bring it to the hospital. Applying a bag valve mask will not help get rid of the vomitus. You can't analyze the vomitus to try to identify the poison in the pre-hospital setting. That has to be left for the hospital to do. You should never suction for longer than 15 seconds. Review question 3. When caring for a patient with a surface contact poisoning, it is important to remember to A. Prevent contamination of the patient. B. Avoid contaminating yourself or others. C. Let the hospital remove the surface poison. D. Immediately flush dry chemicals with water. The correct answer is B. Emergency care for a patient with a surface contact poisoning includes avoiding contaminating yourself and others, and removing the irritating or corrosive substance from the patient as rapidly as possible. Dry chemicals must be brushed from the body prior to flushing with water. A. The patient is already contaminated and you must try to minimize further contamination. B is the correct answer. You do not want to come in contact with the poison. Remember to wear proper PPEs for the condition and call. Let the hospital remove the surface poison. Removing the irritating or corrosive substance as rapidly as possible is incredibly important to the care of your patient. D. You have to brush off the chemicals first before washing. Review question 4. Most poisonings occur via the blank route. A. Injection. B. Ingestion. C. Inhalation. D. Absorption. The correct answer is B. Approximately 80% of all poisonings occur by ingestion. Less than 20% of poisonings occur via injection. The correct answer is B. Less than 20% of poisonings occur via inhalation, and less than 20% of poisonings occur via absorption. Review question 5. How much activated charcoal should you administer to a 55-pound child who swallowed a bottle of aspirin? A. 12.5 grams. B. 25 grams. C. 2 grams/kilograms. D. 50 grams. The correct answer is B. The usual dose of activated charcoal for adults and children is 1 gram of charcoal per kilogram of body weight. To convert the patient's weight from pounds to kilograms, simply divide the weight in pounds by 2.2. Therefore, a 55-pound child should receive 25 grams of activated charcoal. 55 pounds divided by 2.2 equals 25. The average pediatric dosing range for activated charcoal is 12.5 to 25 grams. 12.5 grams at a 1 gram per kilogram dose would be given to a 27-pound child. B is the correct answer. The standard dose is 1 gram per kilogram. 50 grams is 1 gram per kilogram dose would be given to a patient weighing 110 pounds. Review question 6. After taking Vicodin for 2 years for chronic pain, a 40-year-old woman finds that her usual dose is no longer effective and goes to the doctor to request a higher dose. This is an example of A. Addiction, B. Dependence, C. Tolerance, and D. Drug abuse. The correct answer is C. A person who takes a medication for a prolonged period of time often finds that higher doses of the medication are required to achieve the same effect. This is called tolerance. Answer A, addiction. This is a physiological or psychological dependence on a potentially harmful drug. Dependence, this is a physical or psychological need to use a drug. The correct answer is C, tolerance. Drug abuse, this is the deliberate use of an illegal drug or too much of a prescribed drug. Review question 7. Which of the following effects does drinking alcohol not produce? A, induction of sleep. B, slowing of reflexes. C, inappropriate behavior. D, increased sense of awareness. The correct answer is D. Drinking alcohol, ethyl alcohol, is both a sedative, decreases the activity and excitement, and a hypnotic, induces sleep. It dulls the sense of awareness and slows the reflexes and reduces reaction time. It may also cause aggression or inappropriate behavior and lack of coordination. A, induction of sleep. It is a hypnotic and induces sleep. Slowing of reflexes, it is a sedative and reduces reaction time. Inappropriate behavior. Alcohol may cause aggressive or inappropriate behavior. The correct answer is D. Review question 8. A 20-year-old male was found unconscious in an alley. Your initial assessment reveals that his respirations are slow and shallow, and his pulse is slow and weak. Further assessment reveals that his pupils are bilaterally constricted. His presentation is most consistent with an overdose of A, cocaine, B, an opioid, C, a stimulant drug, or D, methamphetamine. The correct answer is B. Opioids are central nervous system depressant drugs. When taken in excess, they can cause respiratory depression, bradycardia, and hypotension. Another common side is paralysis, constricted pinpoint pupils. Cocaine is a stimulant drug, or upper, and methamphetamine have the opposite effect. They stimulate the central nervous system and cause tachycardia and hypertension. Cocaine, this increases the vitals, heart rate, pulse, and breathing. B is the correct answer. C, this increases the vitals, heart rate, pulse, and breathing, and the same goes for D, methamphetamine. Review question 9. The mnemonic dumbbells can be used to recall the signs and symptoms of a chlorogenic drug poisoning. The E in dumbbell stands for A, emesis, B, arrhythmia, C, echomorasis, D, elevated blood pressure. The correct answer is A. The mnemonic dumbbells, which can help you recall the signs and symptoms of chlorogenic drug poisoning, stands for excessive defecation, urination, moralis, or pupillary constriction, brachial chorea, emesis, lacrimation, and salivation. The correct answer is A. Arrhythmia is the redness of the skin usually caused by fever or inflammation. C is the bleeding from broken blood vessels into surrounding tissues, and elevated blood pressure usually causes bradycardia. Review question 10. Food poisoning is almost always caused by eating food that contains A, fungi, B, viruses, C, bacteria, or D, protozoa. The correct answer is C. Food poisoning is almost always caused by eating food that contains bacteria. Salmonella poisoning and botulism are two common forms of food poisoning. Both are caused by bacteria. Fungi, including mildews, molds, mushrooms, ruts, smuts, and yeasts. Viruses are not considered to be independent living organisms. Viruses need a living host and are not found in food. Bacteria is the correct answer. Protozoa are single-celled organisms. This concludes the lecture on Chapter 21, Toxicology. Thank you for listening. If you have any issues or questions, please contact your instructor, and I will see you in the next chapter.